We all have hormones that are constantly ebbing and flowing to regulate our needs throughout the day. This process is how we wake up, know when we're hungry, why we feel energized, and so much more. Hormones are really the foundation of who we are. But when we experience extreme fluctuations, they can make us feel like a stranger in our own body. And though they affect both sexes, Dr. Julie Taylor says women tend to be more significantly impacted by the dramatic variations that occur.
You think about periods when teenage girls are just starting and how those hormones really change throughout the month. We think again about pregnancy and postpartum, and those hormones are again having these dramatic shifts. And then again, around perimenopause and menopause, the hormones are really fluctuating. Men have hormonal issues as well, but they're just not as dramatic of a shift as women experience.
Taylor is a functional medicine physician and author of the Hormone Manual, a straightforward guide for every woman at every stage of life. Conversations around hormone regulation have become more mainstream, but there's often so much information to sift through that many women may decide to ignore it altogether. But Taylor says being ignorant of your body can have damaging repercussions.
I have had women who come in the depths of despair, depression, anxiety. Women can become suicidal if they are having dramatic hormone shifts and not getting those properly treated. Women can have fibroids and cysts and heavy periods and migraines. They can have physical manifestations of their hormonal issues as well as mental.
Since hormones control so many of our body's processes, Taylor says women need to start looking at them as the main suspect for any issues that arise.
So if we talk about teenagers, for example, teenagers, if they're experiencing migraines, if they're experiencing heavy periods, if they're experiencing painful periods, if they're experiencing PMS related to their cycle, I want them and their moms to really think about their hormones being the root cause of their symptoms rather than they need to get on birth control or they need to get on an antidepressant or they need to get on a triptan for their migraines or they need to just take round-the-clock Advil for 72 hours to get through what they're experiencing. We tend to just shy away from hormones and really, really ignore them and almost consider them kind of like a four-letter word. They really affect so much of how we feel. And so when we're having these different symptoms, especially when they're related to the cycle, I really want women to think about their hormones as being the root cause.
Years ago, Taylor had been treating a woman who just happened to mention her daughter's mental health struggles. The young girl had been admitted into a psych ward multiple times for suicidal thoughts.
After digging deep, we discovered that every single time she woke up in the psych ward the very next day after being admitted, she started her period. And that was just such a compelling story to me that her hormones were completely impacting her mood. They were causing her to be in severe depression. No one was figuring that out. No one was really analyzing that her period and her hormones were related to how she was feeling.
If hormones impact our lives so much, why aren't they the first thing doctors consider when women come in with many common medical issues? In short, Taylor says it's simply not something that they're trained to do.
There is not that education in medical school. There's not that education in our training in residency. So that's the reason why doctors are not looking at hormones as root cause. Really, the way that we learn how to be doctors is we learn how the body operates. We learn the anatomy. We learn the physiology. We learn how disease happens and what that looks like. But we don't learn about how to sort of look at the root cause of those symptoms. We really learn how to treat those symptoms with medications. So if you have a symptom, what's the medication to start? And then if that medication doesn't work, what's the next medication to start? What are the procedures involved that can treat those different things?
And though many physicians can test hormone levels, Taylor says most don't know what to look for and will send women away saying that their levels are fine, when that's the furthest thing from the truth. And it's not that they don't want to help, it's a lack of education.
So I go to my doctor and I think that they're going to have all the answers, but you're barking up the wrong tree and you're going to be frustrated because they likely, very, very likely, do not have the training to really analyze what you're experiencing and to really do the tests that are required.
Taylor says the proper lab work isn't just a simple blood test. Not only does the physician have to know the right tests to order, but they have to be able to accurately read the results as it pertains to each woman's individual needs, not just a standard range set on paper. The exact process will look different for each patient depending on which stage of life they're in.
If they're still having a cycle, then I look at their hormones based on their cycle. So sort of the tests that need to be done are very specific tests that are based on the menstrual cycle. So usually they're done in the luteal phase of the cycle, which is after ovulation and before the period starts. And if you think about it, that's when most women have their symptoms, is like that week before the period begins. They're feeling depressed, they're not sleeping as well, they're anxious, their energy's low, they're moody, whatever it is.
Once those tests come back, Taylor can identify any imbalances or other hormonal issues. She says that in many cases, the main culprit is low progesterone.
Progesterone is my favorite hormone because it really impacts mood and it impacts sleep. And those are really kind of the biggest symptoms oftentimes that women come in with. I can't sleep, or I'm just depressed all the time and I don't know why. Progesterone is our natural antidepressant. You think of postpartum women. What is their symptom? If you really have postpartum, it's depression. You have postpartum depression. So when we are pregnant, we are flooded with progesterone. It is what is sustaining the pregnancy. And oftentimes miscarriage is actually due to low progesterone. But a lot of times that's not adequately evaluated. So women are suffering from miscarriage and they don't know why. So postpartum depression is due to that lack of progesterone. You've just kind of delivered all of your progesterone through that placenta, and now you're at a deficiency. So some women, they have enough of a reserve and they're fine. Other women, they're not fine. And so that progesterone, if you supplement with progesterone for those postpartum depressed women, they are able to get out of their depression.
For women who are going through perimenopause or are menopausal, they're having a decline of various hormones, including progesterone, estrogen, and testosterone.
So testosterone is a big one for women. I mean, we typically think of testosterone as a male hormone, but we make more testosterone than we make estrogen. So testosterone is super powerful for us. And when our testosterone declines, it causes low libido and low muscle mass and low energy and low motivation and just like not feeling like you want to do anything. So testosterone replacement is amazing for women.
Since most women have to seek out a specialized physician to get this accurate testing and analysis done, it can feel like a luxury. And depending on their health insurance, hormone replacement therapy may not be included in their plan, and that out-of-pocket expense may keep them from pursuing this option. However, Taylor argues that just because it hasn't been included in the set standard like primary care physicians, this knowledge is necessary.
It's not a luxury to really figure out what's going on. I mean, it's kind of like, the concept of getting a chest x-ray maybe versus like getting a CT scan or an MRI. Like if you really need that CT or MRI, you're going to do it because you have to. So I think this concept of like a luxury, I mean, it's kind of the difference of, again, like some women are truly suicidal. I mean, women around menopause have a higher risk of suicidality than basically any other stage of their lives. Women are getting divorced around 50 all the time. I mean, it's a high incidence of that. So it's not a luxury. It's just that we think we've been disillusioned. We've been kind of coerced into thinking that it's a luxury. But I think that the other flip side of that is if you don't get your hormones managed, then you're just on a bunch of other medications that are just treating the symptoms. So it's not really a luxury. It's your life. It's the difference between constant anxiety or constant depression or constantly not feeling good versus not.
Taylor says this idea is especially true for women going through menopause. More often than not, they're told that they just have to suffer with the extreme mood swings, hot flashes, and other symptoms that drastically affect their quality of life. But in reality, Taylor says a majority of these symptoms can be addressed.
You don't have to just suffer. I think that that's been sort of a misconception for a really long time, and taking that on as women. We've taken it on that like, this is just our lot and this is just how it is. If you think about periods and heavy periods, women changing their tampon every 2 hours, and they just think like, this is just, oh, doesn't everybody go through this? This is just kind of how it is. This is just how it is for me. But that's not normal.
It's important to note that managing hormones can be a long process, and it's one that will change as women age and enter different stages of life. Still, Taylor believes it's not just a worthwhile journey, but a necessary one.
They're complicated, they're complex. It's not like, we knock it out of the park like easily. Hormones take a lot of work to manage. And it's not like just because you start on a treatment, that's the treatment that you're going to have for the next 20 years. I mean, hormones are constantly fluctuating, and what you need now is maybe not what you need in 6 months. So again, the intricacies of treatment are complicated and they fluctuate. So it's important to have those hormones managed and tested and all of that frequently. But I think that women can feel better than ever. I mean, they don't have to sort of accept their symptoms as their new normal.
Taylor's book, The Hormone Manual, is available now wherever books are sold. You can find more information about Dr. Julie Taylor and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zavari. I'm Elizabeth Westfield.